First, let me share what is going on behind the counter. One of the most common food allergies affecting kids these days is peanut allergies. And anyone who has kids in public schools or private schools knows just how frustrating it can be, even if your child isn't the one with the allergy. But current treatments by allergists involve combining peanut flour with other foods and feeding it to the child under supervision. They're somewhat effective, but there is risk of severe reaction with that treatment. The Journal of Allergy and Clinical Immunology has published new research into a therapy called sublingual immunotherapy. During the therapy, allergists put a few drops of a pure peanut protein underneath the tongue of a child between the ages of 1 and 4. And they did this for a long time. It was a double-blind, placebo-controlled trial that lasted 3 years. And the results exceeded expectations. They were 80% of peanut allergic toddlers tolerated 15 peanuts without symptoms by the end of treatment. Typically, for a peanut allergic child, 1 peanut will set them off. So for them to be able to tolerate 15, that's outstanding. The desensitization, they said, was on par with the current therapy, but 63% stayed protected 3 months after stopping treatment. And the best part is this is an easier, better, faster, and safer treatment because the likelihood of severe allergic reaction requiring emergency medical care is significantly lower with this new protein treatment. So very cool. If you have a little one with peanut allergies, ask about that at the doctor. And some interesting news out of Europe. Heart injuries, like a heart attack, cause the body to release a protein into the blood called troponin. When you go to the hospital, the doctor will often perform a test looking for that as a sign of what could be the problem, especially if you're complaining of things like chest pain or what have you. Current tests catch about 80% of the cases where that has occurred, but that means that about 20% get missed. And they have to be caught by other signs or indicators, or they just don't get caught at all. About 20% of all patients who have had a heart attack will have another within the next 5 years. And that's really, really rough, especially in those first few months following the heart attack. The risk is just off the charts. So knowing that you have had a heart attack and being treated immediately is key. So of all the people who have had heart attacks, about 1 in 5 is at an exceedingly high risk of having a second heart attack because they were never told they had one to begin with. Researchers at the University of Edinburgh have developed a new high-sensitivity test for troponin. They tested it at 10 ERs across Scotland on over 50,000 people. 2,000 of those were only caught by the new test. Now, of course, not all 50,000 had had heart attacks. About 10,000 of them had. But 2,000 of those tests were only caught with the new high-sensitivity test. Researchers followed all 50,000 people for 5 years, and this allowed for a roughly 10% reduction of second heart attacks in the at-risk group because they were able to get appropriate treatment. These tests have now been rolled out all over the UK and will hopefully be coming to the US in the very near future. So if you go in checking for chest pain or heart attack, make sure that you talk to the folks in the ER and ask if it's the...
If you can.
Yeah, if you can. They may not have it yet, but...
Yeah, I mean, at least you know there's some cutting edge, lab work being done potentially. That
there's a new way of catching things that had been previously unnoticed. That's a really cool, that's a really cool thing in my estimation. Now, typically at this point, I would ask you a question, but I don't have any questions to ask you about that.
Those couple of things at face value are useful.
Yeah, they're exciting.